Today we will be recording our webinar for those that cannot attend a virtual event to be posted online. So please, however you feel, if it's staying on video or not, it's up to you, but we will be recording the webinar for the public to review in the future. So welcome. My name is Jillian Gellings. I am the Family First Prevention Services Supervisor here at DCYF. I am joined by a few others from our Family First team. I will have them introduce themselves quickly, and then I'm going to pull up our screen. Phyllis.
Good evening, everyone. Phyllis Souza, Family First Prevention Services Administrator. I will be managing the chat and admitting folks who are entering tonight's session.
Good evening. My name is Stephanie Bieber. I'm the Family First Prevention Program Consultant for Region 6, which is Southwest Washington and sort of the west side up to the peninsula.
Good evening. My name is Kabrab Hailegiorgisel, so go by KB. I am the Program Consultant for Family First Prevention Services in Region 4, which means the King County.
Thank you very much. I am going to pull up a slide deck here. So please let me know if there is any difficulty viewing the slide deck. Are we good? Okay, we're good. Great. Well, thank you all so much for attending this webinar. We're excited to share some of the work happening around Family First and the process that we are undertaking as we go forward and submit a new 5-year prevention plan. Today's material is mostly going to be in just a educational format. We're going to go through this PowerPoint slide deck, and there'll be opportunities in the chat if you need to pose a question. Otherwise, we're going to have a couple of interactive polls. And then towards the end, we're going to talk about like next steps as far as further participation and how you can submit further comment as for consideration as our team works at drafting our new 5-year plan. So I'm going to have us take a quick moment. I'm going to pass the mic back to Phyllis briefly to just start us off today with a land acknowledgement.
I want to acknowledge that the state of Washington was built on the traditional and sacred homelands of more than 29 federally recognized tribes and 3 non-federally recognized tribes. Please join us in honoring the traditional tribal land where you reside. Although each tribe is unique, they also share some similarities. Historically, tribes have relied upon fishing as their main source of food, as well as hunting, among others, elk, deer, and bear. The 5 species of ocean-going salmon native to this area are especially important for the Coast Salish people. Berries, such as huckleberries, were gathered in the high country and were pounded into cakes for drying. Strips of cedar bark were harvested from huge standing trees in the spring when it could be pulled away easily for later use in clothing and baskets. We pay our respect to the tribal elders, both past and present, as well as to all Indigenous people today. We are honored and grateful to be here on their traditional lands. With this tribal acknowledgement, we open our time together by honoring the ancestors whose feet first knew these lands and whose paddles still know the waters of what we now call the state of Washington.
Thank you, Phyllis. So I briefly shared this in our introduction as I welcomed you all into the webinar today, but the focus of why we are hosting these virtual town halls and really engaging throughout our communities here in Washington is that DCYF is submitting a new 5-year Family First Prevention Services prevention plan. And really by engaging our communities, we're hoping that communities in all sorts of ranges, whether providers, and caregivers, lived experts, really can be part of shaping the prevention work here in Washington. Excitedly, there is some more updated policy language that allows for more flexibility, as well as just the Children's Bureau really encouraging Title IV jurisdictions to be more broad in looking upstream and really looking at how the Prevention Services Act can serve more families in the community prior to any Title IV agency involvement. And Title IV agency is really that child welfare agency, however that is managed in a state or at a tribe. So Family First Prevention Services Act. This is new legislation that was signed in February of 2018, and the focus on it is really to transform our child welfare system. Those Title IV funds that I just mentioned out of that Title IV program can now be used as part of this legislation to fund services to keep families together in the home. So funding preventative services for a family far earlier and before any child removal from a family or home. And so this is just really one of the largest transformational change made to the child welfare system in about 3 decades. There's really been no action to how those Title IV programs worked until 2018. Washington has had an approved plan since 2020 and has been one of the very first jurisdictions to start to expand into this work. So Title IV traditionally has only funded services once a child has been removed from a family. So really centering our child welfare responses that are more heavily reliant on funding with out-of-home placements versus really supporting a family while they're in need and still together in the home. So on the left of the screen, really the Title IV funded programs prior to Family First were foster care assistance, adoption assistance, guardianship assistance, and extended foster care. So that's where the reimbursements lied. And so that's what it really was influential of Title IV agencies or jurisdictions building a child welfare system around. And now through Title IV Family First Prevention Services Act, like I said, services can be paid for by funding through this Social Security Act element, Title IV to those services in the home. So really just to get a kind of an idea of the knowledge that you all bring to this webinar, I have a quick poll question. And it's just a basic yes or no, wondering what is your prior knowledge of the Family First Prevention Services Act? Do you know a lot? Yes, or are you relatively, is this relatively a new topic for you? So we'll give a couple of minutes. This just helps so I can have an idea on how detailed to go into, or where some of our questions or comments might come from tonight. So if you, oh wow, 100% online that have some prior knowledge. That's excellent. Well, thank you for coming today and joining this webinar. I really appreciate it. So we can stop that. We had everybody here on the line answered a big yes. So thank you. All right. So, oops, sorry, my screens are a little slow. So the title, what is the 5-year Title IV prevention plan? Well, this is a requirement out of that legislation if a jurisdiction decides to opt into the prevention program. So Title IV on the broader scale of those foster care, adoption assistance, those elements is all mandatory for a jurisdiction. However, if states or tribes want to utilize this opportunity for prevention services to be funded by Title IV, the state or tribe must submit a 5-year plan to the federal government. So the Children's Bureau, they will review the plan and approve the plan. And that again is for every 5-year cycle. So today we're here, and over the last few weeks, we have been engaging the community, talking about our current efforts and updating our plan, and getting really kind of suggestions from the public as to where we can apply and expand based on needs. So the purpose of creating a new prevention plan really centers around a few different things. Like I had mentioned, our current plan is approved for 2020 through 2024. The Children's Bureau issued new program instructions the May of this calendar year, really instructing jurisdictions as to what their options are if they choose to continue with a prevention plan. Some agencies have not elected to submit a plan as to date, I should say. So for those jurisdictions, the program instructions are different than for jurisdictions that applied prior. States can elect to continue a 5-year plan. So taking their current plan and continuing that an additional 5 years, or they can elect to submit a new plan. And really Washington, based on some of the changing landscape, is opting to submit a new plan because there is broader application of the FFPSA program that can be done. Things like community-based opportunities and new policies really broadening the ability for tribes with Title IV agreements with the state to include tribal prevention services that are really more culturally responsive to that tribal community. And we'll go into further detail about some of these opportunities and more of those policies in a few short slides. So really, I wanted to highlight some of the things that we hope to expand that from our current plan that really kind of are gaps to what Washington has in their plan compared to other jurisdictions throughout the nation. as we look to really impact families upstream. So because Washington was one of the very first states to submit a plan, the approach was to be a lot more conservative. And so Washington elected to have more of a narrow definition of candidacy, which we will talk about what that word means. Really looking at mostly children that have already been involved with the system and are already involved with the system. The EBPs, evidence-based practices, I want to say sometimes procedures at times, evidence-based practices that a jurisdiction can elect to have included in the plan for reimbursement. Those services that can be included in the plan have to be approved by the Title IV-E clearinghouse. So for most of you online are pretty informed about Family First. And so the clearinghouse was a brand new thing that was created. There are other clearinghouses for other types of things out there to really review and rate the evidence behind a service. And so the Title IV-E agency is what we as, or the clearinghouse is what we're tied to as a Title IV-E agency to review, to choose from for the services we can include in our plan. We'll talk a lot more about services in a few slides, but I just wanted to focus briefly on the fact that most of those services included in our plan are really focused on parent skills. And there can be broader service coverage that is allowable through the Family First Prevention Services Act. And then I guess I wanted to also highlight that services are accessible only to children, youth, and families involved with DCYF. And that really is based on that eligibility determination or candidacy, which is the term that's used in the law itself. And so from our gaps and barriers, I like to do a flip, and that's where really in lies the opportunities for updating our plan. So as we think of who can be eligible for services, that's tied to our candidacy definition, which we'll talk again more about. I'm just kind of laying the groundwork as we broaden our candidacy definition. We can look to expand the EBPs, the evidence-based practices, those services in our plan. Most of the services that had been included in our last plan were really ones that DCYF as an agency already had contracted providers that fell under. So we really kind of looked at a more narrow approach. So the opportunity today is to really look and see how and where we can expand. Tribal prevention services, our very next slide talks about the opportunities for tribes with Title IV-E agreements to have services that are not linked to the clearinghouse included in DCYF's plan versus having a direct agreement with the Children's Bureau or the federal government. So that's a broader opportunity, and just highlighting then the Title IV-E agreements as well. The opportunities for tribes to do more through a pass-through agreement when it comes to prevention services. There is also opportunity with Title IV-E agreements for county juvenile courts to be able to do some of this prevention work through agreements with DCYF as well. And then two final opportunities. We'll talk a little bit more about the community-based pathway. That's a new term to the world of child welfare in relation to Title IV-E. However, what is incredible about the community pathway is that it is working to build opportunity for children, youth, and families who are eligible for this program to receive services so far upstream that there is no DCYF involvement. And so it's directly linked to our definition of eligibility, but it will allow for services to be paid for without DCYF involvement, which is really extraordinary in the world of child welfare, to really be able to fund services at the moment that that need or those risk factors are made aware. And then lastly, just focusing on disproportionality as a whole in our system. Family First being able to really look at addressing families as early on allows for a lot of opportunities here. And DCYF in Washington, we have high rates of removals, especially around our BIPOC families. And so how we can really leverage the ability to be culturally responsive in the services that we offer, we hope to address the disproportionality within the system overall. So the new policies for tribal services and the flexibility. When Family First Prevention Services Act was passed in 2018, the guidance was that for tribes to be able to utilize services that are really responsive and meet their culture and context of their own tribe, they had to have a direct agreement with the Children's Bureau to include those services within their prevention plan. And there are very few tribes throughout the nation that actually have their own Title IV-E plan. And so access to the prevention services was really not something that tribes were able to do because it came with so many more administrative tasks. So really kind of a burdensome system. It still is a system with lots of hoops to jump through, yet the Biden-Harris administration in July of this year issued flexibility that tribes can have that same flexibility opportunity if they had an agreement with the Title IV-E agency, in this case DCYF, to really be able to include those as a part of our plan. Again, there has to be the Title IV-E agreement, but this really continues to advance the prevention services program that's funded through Title IV-E. Really, and also saying, to the public that that there is respect for that tribal sovereignty, and really figuring out ways that we can assist children and families before any sort of crisis response, and really just emphasizing that culture is prevention. And that is something that we are closely working at as we continually engage tribes with this prevention plan, and then with Title IV-E agreements to come. Two more little pieces of flexibility that came as part of these new policies is expanding what can be covered as far as administrative costs. So we have now the ability to have costs such as childcare, transportation, case management, and peer navigation as part of activities that can help families get to these preventative services. So in a way to really remove barriers as much as we can for families to access services. And then another one is really the focus on separating poverty and neglect. Washington has really been working very hard at this, even prior to this new guidance. But just the fact that it's coming from the federal government as we work to expand prevention, it's just something to again highlight that that point being made. So before we talk a little bit more about FFPSA prevention services, I wanted to just talk a moment about the levels of prevention. And many different organizations have different concepts of prevention and what prevention means. And so I just want to highlight this as a slide as we talk about prevention services, how it fits into FFPSA. So as it relates to family first, this is kind of the levels of prevention. So primary prevention is really something that we're talking about, those programs targeted at an entire population to provide support and education before problems occur. So no problems identified with as far as child safety is concerned, and really center around things available to the entire population. So I like to compare things like SNAP or TANF or WIC, those public assistance programs that are eligible for, or that really target an entire population. As far as secondary level of prevention, this is more as I have now identified problems and we want to alleviate any further escalation. So there might be an assessment done somewhere in an interaction with a family and there has been needs identified. So this is where we could have prevention services come in to really alleviate any further escalation. And then tertiary, once this is really around services for providing interventions for children experiencing maltreatment. So once there is maltreatment identified. I do want to also emphasize though that as we talk about secondary and tertiary as it relates to family first, because that's really where this funding through Title IV-E lies, I did want to say that just because maybe there is a secondary or tertiary level of interventions needed, it doesn't necessarily mean child welfare needs to be involved. So there could be services that are more tertiary in nature as on that scale of levels of prevention that maybe aren't centered around a child welfare being involved. So again, highlighting that secondary and tertiary is really where that funding is. So what is a prevention service? I've talked a little bit about prevention services, and I've said the evidence-based practices multiple times now. So what is this? These are services to prevent children from being removed from their home. So keeping families together in the home is what the prevention services through Family First again are centered around. And this could be a parent, a relative caregiver, or a kinship caregiver. It must be one of 3 federally identified programs or service areas. Our next slide will talk about what those 3 are in more detail. However, it must be one of the 3. And all of these elements are directly tied to the Family First requirements. So there isn't wiggle room when it comes to these elements. It must be an evidence-based practice that has been approved by the Title IV Clearinghouse. Again, that is that agency that reviews services, and it meets a level of evaluation that is rated high enough and shows enough evidence to be approved by the clearinghouse. The clearinghouse again is a relatively new agency as well, so not a ton has been reviewed. But we are required to utilize that. That is a requirement of FFPSA, is that evidence-based practices must be approved by the clearinghouse. Now, when there is a tribe that has the Title IV agreement, that is where we can have services included in our plan that can be reimbursed through Title IV that are not rated by the clearinghouse. This is that tribal flexibility I talked about prior. And then lastly, I just wanted to highlight as we will look at a slide with our current approved services, that really most of those services in our plan, again, are more of those in-home skill-based parent skill-based services with a little bit of evidence for use for substance use disorder services as well. So requirements for Title IV prevention funding. I had highlighted that we have to have one impact area. So the 3 impact areas are mental health, parent skills, and substance use. And you can see the bubbles overlap, and that's intentional because a lot of EBPs that have been reviewed by the clearinghouse may impact one or more of these target areas, with some even impacting all 3. And so there is that opportunity to include some of those EBPs that really cross over. I wanted to highlight again with the clearinghouse and how they rate based on the evidence that is tied to the service. The clearinghouse will give 3 different ratings for approval. The first rating is well supported, meaning it has the highest level of rating or research backing that service. The following is supported, meaning there's a lot, but not meeting that highest level of review. And then that lowest rating is promising. And the numbers here on this slide highlight the number of services that have been given this rating. So within the clearinghouse, there are 19 services rated well supported, 25 for supported, and 45 for promising. There have been an additional 86 services that have been reviewed but did not qualify to be listed as a service that Title IV-E can cover through the prevention plan. Additionally, I did want to highlight that Washington has a kinship navigator program that has recently been rated by the clearinghouse and was given a rating of supported. So that's an exciting thing. Services can be created by jurisdictions and researched and put evidence together to submit to the clearinghouse, or it could be a model that has been used for a long time. So a really kind of cool opportunity to highlight that it doesn't have to be a model that's developed by you know, a university. States jurisdictions can develop these EBPs as well. So Washington just had one approved. Two other things to focus on as we think of the well-supported services is a state must have at least 50% of their reimbursement be for well-supported EBPs. So if you compare or look at other agencies' Title IV-E prevention plans, most of them really center around the services that are well-supported. And then another really wonderful thing that we have the opportunity to do with our well-supported services is to make cultural adaptations to those services. So those services can have minor adaptations made to meet the community's cultural needs. All right. So I had mentioned our current plan multiple times, so I did want to highlight what is currently approved by the Children's Bureau here in Washington. These services, for the most part, had been already utilized by the department in some ways, whether they were our combined in-home services that our child welfare system has been utilizing, or also our strengthening families team that has home visiting services offered through DCYF. Highlighting though the motivational interviewing that is listed. Motivational interviewing is really a cross communication tool that can be utilized as a service, but also as an administrative activity. And so as we talk at the very end of the webinar about some of the work that's been going on here at DCYF, motivational interviewing is a EBP that Washington is capitalizing on in efforts to have the workforce trained, really to increase family involvement and partnership in prevention services to the family. So here comes our next poll. Phyllis, if you can bring that up. Just generally thinking from your perspective in your community or in your work, wherever you want to pull this input for is regarding these prevention services, the target services, mental health, substance use, and parent skills. What is most needed in your community? Or are there services, but could we benefit from more culturally responsive services? And you can select more than just one. This just kind of gives us a little pulse as to where people are coming from.
I forgot to make it multiple choice. My apologies.
Oh, that's okay. No worries. in the chat. If you want to add more, you sure can. We'll give just another 30 seconds for folks to respond, and then we'll stop. All right, Phyllis, if you want to end the poll, we can share it really quick. Nice little blend with a little few more responses coming and for that substance use disorder treatment services. So thank you. All right, now I want to shift gears. We talked a lot about the what, right? FFPSA can fund services. Okay, these are the elements that we have to think about as we look to implement services and then also evaluate. However, now I want to shift into the who. So who is eligible for these services? So the who is very much tied to the act. However, the who is also growing in the ability for jurisdictions to meet a broader population of people. So per the Family First Prevention Services Act, if you look at the law, you will see the term candidate for foster care, or you will see the word imminent risk for foster of removal. And those two things, I like to note, are tied to the law, but actually predate the Family First Prevention Services Act. So this population of people, the children and youth and families, there has been that terminology used that predates the Family First. What came out of that legislation is the opportunity really for the funding for services. So the who in relation to the law really talks about and emphasizes on children that are in home or in a kinship placement for eligibility. This also includes a child whose adoption or guardianship is at risk of dissolution. And it also includes parents and kinship caregivers or relative caregivers for the coverage of those services, meaning the child could receive the services, but also the caregivers could receive the services. Now, an additional element that does not need to have an eligibility verified is if a youth in foster care is pregnant or parenting. So for the candidacy, but in the terminology of the act relates to, you have to verify the eligibility. But with the foster care who are pregnant or parenting, it is an automatically there is coverage for these prevention services. Now, although I've talked about that law, I want to really emphasize the direction that this eligibility is going for funding of these services. And that's really with the Children's Bureau encouraging for state and local or tribal Title IV agencies to define their eligibility on their own. It still does have to be approved by the Children's Bureau, but really encouraging states to be broad, think upstream to really prevent any child welfare involvement in the first place. And how we do that is through our eligibility determination. And that really is up to us to define, operationalize, and include in our 5-year plan. And so I just went through that law. I like to add in, before we shift into like some examples of eligibility, I really like to center around this quote by the Children's Bureau, because it really does emphasize the direction that Family First Prevention Services are going. So even though there is the law that is narrow, really the expansion is very, very broad in how states utilize their program. So I like to read this. I know it's a little silly because you all can read, but the Children's Bureau strongly believes working with families sooner through upfront primary prevention efforts is necessary to improve child welfare outcomes nationally. Committing to a broader continuum of prevention services that emphasizes primary prevention is contingent on a change of mindset and reorientation of what child welfare is intended to accomplish. Child protection will always be paramount and will always be needed, but the system can and should be designed to protect children by keeping families safe, healthy, and together whenever possible before remedial efforts become necessary. And that's really where, as we talk about our definition of eligibility for this service, we are centering and really finding ways to provide services to children, youth, and families without DCYF involvement. And so just for context of like where we are today in our current plan, I do like to show this slide that lists the current groups that are identified as eligible for services in our plan. And as you see on this slide, what is the similar factor is all of these are placement in the home. However, there is the Title IV agency involvement. So CPS family assessment response, CPS investigation, CPS family voluntary services, family reconciliation services, and children on trial return home following placement. All of these have some level of DCYF involvement in the case. Some other ones to highlight: children experiencing adoption displacement, so already involved with child welfare. State juvenile rehabilitation discharge, meaning leaving one of our juvenile rehabilitation state facilities and re-entering community. Again, pregnant and or parenting foster youth and juvenile rehabilitation youth. And then the last two to highlight: children with developmental disabilities and or intensive mental health needs, well within the child welfare system. And then substance using pregnant women. Although I do highlight on this one, although those cases may come to us, Title IV cannot fund until a child has been born. This is something that we are actively working to encourage the Children's Bureau to cover prior to birth of that child. And we are not alone in that advocacy when it comes to that population. So examples I like to share as we kind of look to change our definition of eligibility. Some of the things that have been approved in other jurisdictions. So other states that have wanted to have more of a broader reach for what could be covered under Title 4E have had success in approval through their systems. A few of these you will see are duplicative, but just wanted to highlight. So children identified by another state agency, meaning services through a different agency. Some other jurisdictions, for example, don't have their juvenile rehabilitation within their same agency. So that could be an example. Also things like possibly like qualifying for a TANF program could also have eligibility, then be qualified for Title 4E as well. Some jurisdictions looking at specific home visiting programs. If you meet the qualification to qualify for services of a home visiting program, you meet the level of qualification to be eligible for the Title 4E funding for it. Some other pretty simple kind of comparisons: children of former foster youth, siblings of youth in foster care, possibly a hotline call, so a transfer, infants born substance exposed, children of incarcerated parents, or children who are chronically absent from school. This is in no way a comprehensive list. These are just some things that I wanted to kind of call out as we kind of look to other jurisdictions, and some things that have been part of conversations as we've been talking to community. So the next poll that I have for you, and Phyllis will pull this one up, is thinking about eligibility here in Washington. And as DCYF looks to really create a new definition, what are prevention indicators that you all see as a high priority in your community? And again, this list is just some ideas. And I'm hoping that after this webinar, you all can continue to think on this, and we'll hopefully submit any further comments or considerations to us as well. But really thinking about those prevention indicators, I like to say, instead of risk factors, what are the prevention indicators that we could use as we look to identify candidacy? So I know there's a few things to read on this. I'll give you some time, and I'll take a quick drink of water. I'll give another quick 30 seconds and then we will move on. All right, thank you. We can share that. Nice mixture. Lots of agreement on those. So thank you. And I really just encourage you to think further on this, because again, there is, we have this opportunity to really define our population that we can provide these services to. All right, and now as we kind of start to round out the last little bits of our presentation today, I had mentioned this community-based pathway. And this is really where I get very excited of the opportunities that we are seeing as just a national shift in responding to families at the earliest points possible. And when things when we can identify and really mitigate any involvement within the DCYF system. And it's through the opportunity that has been termed the community pathway or community-based pathway. So some new terminology. And this all really comes with the encouragement of the Children's Bureau, really, pushing Title IV jurisdictions, agencies to find ways for families to access these services when there is no connection to a child welfare system, because there is opportunity to impact at that local level, that most trusted level through community organizations. And really part of what we here at DCYF are really focused on doing is that we have the community centered in the discussion of that community-based pathway. So again, that community-based pathway is really about these services that can be funded without DCYF being involved. And so there's a question about the who can serve these families, and how and where, and that is yet for us to kind of discover. So options on this screen, I just want to highlight that these are again not what we are limited to here at DCYF. These are examples that have been pulled from other jurisdictions that have successfully received approval by the Children's Bureau, the federal government, to build a community-based pathway. There are no jurisdictions that are currently operating already because this is so new. Everything is in implementation phase for those that have an approval. And so these are some examples based on what has been approved in their plans. And so places like family resource centers or nonprofits or recognized American Indian organization services, all kind of thinking in that scope of maybe contracted community-based agencies. Opportunities for service providers that are operating these evidence-based prevention services. So for example, those couple listed services, parents as teachers, home builders, safe care. So thinking of families that might self-refer to something like that as they're looking for opportunities. And then we can also think of, as we look at as we look to build this, is thinking about, well, what about public agency partners that are not non-child welfare agencies? So things like Department of Homelessness or Behavioral Health are public assistance. And you can take that even further and think of, your doctor's offices or public health services, or even thinking schools as opportunities to really build this community-based pathway. And so highlighting again, just some points about the relation of this access to services to Family First, and really thinking about this in a way of creating those opportunities to serve families again outside of traditional child welfare context. That's something that our current plan is tied to, is that traditional child welfare kind of system, that DCYF already being involved. Thinking about leveraging federal Title IV funds through Family First for not only the services, but also the administration of these programs. So I had mentioned things like peer navigation. That's an administrative task that goes into getting families to these services, or even things like that, child welfare or transportation to get families to those services as well. So how we can leverage those opportunities. And it really just supports a paradigm shift. Really building on community capacity, strengthening families upstream, and working towards preventing maltreatment in the first place, and working towards reducing child welfare involvement overall. I have two just fun examples from some other agencies and how they really have modeled what they're doing. This example from Los Angeles County, it's a county-run child welfare system. It really talks about no wrong door. So you'll see some listed things within this diagram: hospitals and healthcare clinics, schools, county departments. So thinking of some hotlines or other opportunities families might encounter with their county local government. Family resource centers, that's something that Los Angeles is looking heavily at, a common place that families might access for a lot of different services. Self-referrals as an opportunity. Families often know what they need best, and if they knew where to, or even that they don't even have to have a direct referral, they could just, enter based on this no wrong door kind of model. And then the opportunity too that comes lastly is more on the funding and for agencies to really work together. And that's really blending funding, how to strategize and partner. So families that are accessing multiple different service agencies can have some coordination to their benefits. And then Connecticut also doing a very similar no wrong door approach, really trying to allow opportunities for more voluntary engagement from families. So you can see that's where those care lines and those 211s may be highlighted. And then that top bar, just really thinking of the broad range of potential referral sources: courts, schools, healthcare clinics, even community or faith-based organizations having the resources to refer families to prevention services. So there will be elements of that community-based pathway that will be included in our plan, and that we are planning to submit to the feds by the end of this year as part of our plan. However, there's going to be a lot that comes after the approval as we really look to phase in implementation and build and design what and how the community based pathway can look. And so I just encourage that you all stay involved, watch our website, because there will be community listening sessions that are going to center more around the community-based pathway. And then also further community virtual surveys that will go out. And then before we wrap up, it would be a missed opportunity if I didn't highlight just all of the work that has gone into the last few years around our current prevention plan, and really the work that has gone into shifting the system and building capacity. So the Family First team, some of whom are here today, really have been working so much with our child welfare field caseworkers on the motivational interviewing, communication, and really shifting how we work with families there. Really looking at capacity building. I highlight this because, again, it's a big shift from a crisis response to being more of a preventative agency. Child welfare is decades in the making with the system that we currently have, and it takes time to become a prevention agency, and it takes time even for those that are working with families to have more prevention mindset to begin with at first encounter. And so there's just been a huge shift and a lot of work that's really revolved around that capacity building. Services, expanding our services to really look at ways in which we can become more culturally responsive in the services that we are offering. So Family First is tied to a lot of other pilot projects and work to expand that service array. And then even the expansion that we hope to include in the next 5-year prevention plan. And then finally, claiming. Family First is a reimbursement program, meaning that DCYF or the state has to pay for everything up front, and then qualified claims can be sent to the Children's Bureau for reimbursement. And with Family First, so much goes into what is required for data and how the Children's Bureau receives information. And so that is something that DCYF continues to work to update, to improve, so we can capitalize to the fullest extent that we can with the funding. And that's what really claiming is that reimbursement for that portion from the children or from the federal government. So just a huge kudos to the Family First team for all of the work that has gone in over the last couple years, and is happening at the same time as we update our 5-year plan as well. And so for my final slide, I just really want to encourage you all that are online to be and stay involved with what's going on for the updated plan, and then also following the plan submission to the Children's Bureau. There are some QR codes on the screen if you have any difficulty with getting utilizing a QR code. You can also find all of this information on our Family First Prevention Services website, found on on the DCYF larger site. We have an upcoming listening session on October 22nd from 1:30 to 3:30. that you can register for, which will talk about some of the highlights from what has been collected as far as feedback for consideration in the next plan. And then prior to submission to the Children's Bureau, we are going to be posting the document as a draft for public comment for a 2-week period. That would be issued via a public notice, and the link will be able to be found on our FFPSA once that is ready to go and live. And again, just please continue to, if you have the opportunity or would like to submit any further comments or considerations, please do so by that feedback survey that you can find on our website or utilize that QR code. And so just a huge thank you for you all to take time out of your evening to listen to today's town hall. Please share information. We will be posting a recording of this webinar in the weeks to come. So you can check out our website, find it there, and pass it on for others to listen to. And there's Phyllis reminding me one last time, if you can all just answer our one final poll question, really looking at what is the best communication method to share future engagement opportunities or pass along information, and just to really focus on keeping our community informed. So I'll give you about a couple more seconds. Oh, I think we've all got, yeah, we're all answered. So thank you for that. Email is definitely one that is a common communication consideration. So thank you. Thanks, Phyllis, for popping that up too. So again, just a huge thank you. I know taking some time out of your evening is difficult. So have a wonderful evening. I don't think there were any final questions or comments that came through in the chat. Phyllis, can you just double check? There's this. Oh, excuse me. So thank you again, everybody. Have a wonderful evening. And we look forward to your further feedback and comments. Take care.